In this segment, we will focus on effective communication skills as the fundamental skill for responding to conflict in a productive manner. We will describe the differences between collaborative versus confrontational language and understand how each impact conflict resolution. Additionally, use reframing as a critical communication skill to facilitate joint problem solving, also known as getting to the same side of the table. We will discuss strategies for reframing, and finally, discuss the importance of balancing agenda versus relationship. This will take us back to reviewing the conflict management styles with a focus on the two styles that prioritize both agenda and relationship. These styles rely on the use of collaborative language and reframing. Effective communication skills are critical in conflict resolution. Though this may sound obvious at first, but sometimes what we say, what we don't say, and how we say things deeply influence how effectively we communicate. Even though one may have the best of intentions, the wrong communication style may perpetuate or even worsen the conflict situation. Using collaborative language, or language that aims to establish equal participation between people in conflict and invite collaboration, is a key first step to communicating what you are really trying to say and to invite other person to listen. First, we'll contrast collaborative language and confrontational language and discuss why language styles make a significant difference when attempting to resolve a conflict or during any high-stakes conversation. Then we'll return to conflict examples and highlight examples of each. Let's revisit our conflict in this scenario. Classic examples of confrontational language include when Dr. Williams says, "Are you saying that I got him sick this time? I've been practicing here for almost 30 years and no one has ever accused me of harming my patient." Or when Dr. Miller asks, "Well, anytime you receive a new patient, don't you go over his past medical history thoroughly?" What makes these phrases confrontational? The emphasis on you. They suggest blame, don't really allow the other person to save face, and also imply intent for another's action which may not have been their intention at all. In the first example, Dr. Williams essentially stated that Dr. Miller is accusing him of harming his patient, which he didn't, at least not directly. In the second example, it makes a suggestion for what other person ought to be doing in terms of their clinical practice. In doing so, both examples place an emphasis on the other person as the focus of the problem and are high risk to put the other person on the defensive. When people are feeling defensive, their ability to hear what you are really trying to say, as well as their willingness to want to work together to come up with a solution, become impaired. This is a fast way to getting conversation off to a rough start. Let's now contrast with the example of collaborative language. We'll take the same phrases and put them in another way. Instead of "you failed again," one could say, "I think that we have a problem on our hands. Let's work together to figure out the best next steps." First, it starts out with an opinion that's owned by the speaker and to say they believe the mistake has been made. Next, rather than saying "you failed again," which suggests blame, fault, and makes it really hard for the other person to save face, it highlights that the two people together have a problem on their hands. They are on the same side of the table. Stating "let's work together" conveys a sense of camaraderie to work together towards a solution. This is a highly collaborative in both sharing the problem and the solution. Next, contrast with "what were you thinking?" with "can you help me understand how this happened?" In this new collaborative example, it takes away the suggestion that the other person made a mistake, invites them to share their thought process, and importantly, doesn't imply that fault is being assigned. It gives the other person the benefit of the doubt, welcoming the idea that they had a very good, honest reason for making the decision that they did. In this case, it may help to identify an error in the system-based practice rather than personal fault. So key points here are that there is an emphasis on we and I and take the focus off the other person's presumed intention or fault. This reduces the chances of the other person taking a defensive or adversarial stance and also increases the chances that better understanding of the situation can be shared between the two participants. So, to recap, Contrasting confrontational versus collaborative language, confrontational language limits choices, implies a refusal to listen or unwillingness to consider another's position, challenges the other person, seeks blame, and is directly adversarial or simply claims that you are in the right. It also does not allow the other person to save face. In contrast, collaborative language conveys a very different perspective. It welcomes opinions, conveys a willingness to listen, to consider the other person's position, invites the other person to discuss rather than fight or disagree, invites the other person to work together with you, not dictate what you think should happen, not interested in finding someone to blame, and helps the other person to save face. To properly engage in conflict management, one will need to transfer typical confrontational language to collaborative language. Key points for transforming confrontational to collaborative statements are: use we and I instead of you statements. Take ownership of your feelings. Describe how you feel or what you hope to see happen without attributing it to what the other person may or may not have intended. Select neutral language to remove blame. This will require much practice to become comfortable with the skill. The next critical skill is to reframe the conversation. This is as much of an art as it is a skill. Reframing is defined as restating communication with a focus on problem solving rather than blame. In brief, the goal of reframing is to get on the same side of the table and work collaboratively with the person to solve your problems or clear the misunderstanding between you. There are 3 key pearls on getting on the same side of the table. First, learn to state without interpretation. Do not alter the content of what is being said, including adding interpretation of why you think something happened, which adds blame. Stay true to what you know is true. Sometimes this will only be how you feel in the situation. Avoid making generalizations like using the word always or never. Second, focus on behaviors, not intent. Some may say that you can never change people, but you can change behaviors. In your conflict resolution, it may be best to stick to this principle when the goal of changing behaviors only. For example, reframe "you are excluding me from making key decisions" to "I'm concerned that I'm not invited to participate in key decision-making meetings." Third, de-emphasize or remove blame, advice, or judgment. These put the other person on the defensive, which in turn will make it difficult to move forward. For example, reframe "you hurt me" to "I sometimes feel hurt by your words." Or to remove advice or judgment by reframing "you ought to invite me to the leadership meetings" to "I would like to attend leadership meetings from now on."
So he doesn't qualify, there's nothing we can do. I'm just a doctor here trying to get things moving as fast as I can.
I know, but if you give me a second, I have some ideas.
Back to our hospital scenario, the healthcare team is at an impasse of what is the next best step, as the patient cannot get home health care and the patient's family does not feel comfortable managing a complex antibiotic dosing regimen. Dr. Miller has just said, "If he is not qualified, then there's nothing we can do. I'm just a doctor here trying to get things moving as fast as I can." Pharmacist Anderson focuses on the task at hand and almost instantly reframes the situation. He makes a smart suggestion of using different antibiotic regimen for a longer treatment course instead. He uses several key strategies for reframing. He strips the statement of blame, fault, weakness, or even frustration with the limitations of the healthcare system. He focuses on the behaviors and all the important need to treat the patient instead of getting sidetracked with larger issues, some of which they have no control over. He uses the term "we" that makes it about our problem rather than your problem or what you should do, which is a suggestion. This keeps the connection between involved parties, makes them realize that they are on the same side of this problem and partners towards a solution. Additionally, he also asks for permission. This is a great strategy for diffusing anger or frustration. It asks permission to make a suggestion which welcomes and also shows respect for the other person's opinion. You could imagine that Dr. Miller, in her angered and frustrated state, could misinterpret the suggestion as an order. Just by adding a few words to ask for permission could go a long way to convey that you care about what the other person thinks. As a member of the interprofessional team, it's important to consider both the task at hand and your relationship with your team members when possible. In giving equal consideration to these factors, you will rely on a cooperating or compromising conflict response style, and the key skills are collaborative language and the ability to reframe the conflict. Now for our forum discussion question. In this segment, we discuss reframing as a technique for getting on the same side of the table. Please reframe the following statements with specific technique. The patient says that the nurses all gave her different information about how to take care of herself when she's discharged from the hospital. You always dash out of the room before I have a chance to hear the whole patient status update. The instrument tray was a disaster. How long have you been working in the operating room? We look forward in reading your responses.